Thanks so much for joining us today. My name is Fraser Cobb. I'm the Executive Director of the Physician Society of Central Florida, and appreciate you tuning in today for a special interview that we've put together. And would like to start by thanking AdventHealth for the ability to put this together. And we're very pleased to have with us Dr. Neil Finkler, who has just recently been appointed as Chief Clinical Officer for the Advent system, which is covering their 7-county region in Central Florida. So we're really pleased to have Neil, Dr. Finkler, with us today. We also have Dr. Chuck Chase, who is the president of the Physician Society of Central Florida, with us as well. And our goal is to just learn a little bit about the position that Dr. Finkler has been promoted to, and talk a little bit about the vision and the background on why the position was created, and just get to know him a little bit more as he steps into a new leadership role within the community. So Dr. Finkler, thanks so much for joining us today.
Well, thank you. It's a pleasure to be here, and thanks for the invite.
Absolutely. So let's jump right into the new position, and you want to talk a little bit about kind of the vision behind the position and your role and really the breadth of the system that you'll be overseeing.
Sure. So the role of Chief Clinical Officer for the Central Florida Division is really responsible for all of the clinical activities that occur within our entire division. And just to give our physicians an understanding of the size of our division, the Central Florida Division represents more than 20 hospitals and emergency rooms across 7 counties in and around the surrounding Metro Orlando area. We represent about 3.4 million visits annually, about 4,500 beds, acute care beds, over 500 clinical trials, 176 medical specialties, over 300 AdventHealth medical group practices. This includes 35 urgent care centers and about 6,000 physicians and advanced practice providers. So as you can understand from these numbers, the scope is really pretty vast. And my job, quite frankly, is really to oversee the clinical product that we produce.
Fantastic. And what is the kind of the vision behind the new position? Obviously, it's one that's been created. It hasn't existed before. So what was really the driving force behind consolidating the leadership into this spot?
So I think the big issues here have been we historically have divided this Central Florida region into 2 different divisions. A South Division, which is really the central part of the state, and a North Division, which includes Waterman and our facilities more on the East Coast of Florida. And as we have united into one division, it's very clear that what we need to do is make sure that the product that we deliver is the highest quality possible and is consistent across all of our AdventHealth facilities. And I think that's really the driving force behind a Chief Clinical Officer for the entire division.
So Dr. Finkler, you've been in the area for quite some time. Maybe you could tell us a little bit about your history and how you've worked your way up through the Florida hospital system and become such a leader in that system.
I'd be happy to. So I'm a graduate of the Mount Sinai School of Medicine, now the Carl Icahn School of Medicine in New York City. I then did my internship and residency at Brigham and Women's at Harvard Medical School in obstetrics and gynecology. I stayed at the Brigham and did my fellowship in gynecologic oncology. And then I stayed on staff at the Brigham and came to Florida Hospital in 1992. I was actually part of a group that did some of the consulting work for then Florida Hospital, now AdventHealth, as they were developing a cancer center program. I eventually came here in 1992 to start and develop the cancer program in gynecologic oncology, and did that until 2010. And in 2010, I was asked to become the Chief Medical Officer for our employed physician group, then called Florida Hospital Medical Group, now called AdventHealth Medical Group. And I did that for 4 years before I then went back to AdventHealth Orlando, the hospital, and became the Chief Medical Officer of the large quaternary facility, and did that until 2016, when I came over across the street and became the Chief Medical Officer for our Central Florida Division South, and have just recently now been named the Chief Clinical Officer for the entire division. So I've gotten an opportunity to obviously practice, and I understand what it's like to be in the trenches every day. I've also had an opportunity to be in the employed side to understand what that looks like from an employment side, and then on the facility side, both at the hospital as well as the CMO for the acute care services. So I've had a smattering of experiences. Again, I've been here since '92. I think I know most of the people within the area. Some of the new faces, obviously, I don't know as well. But again, to your point, I've been here coming up on, will soon start my 30th year of employment with AdventHealth.
Yeah, if I can ask a follow-up to that, Dr. Finkler, I mean, at what point did you know you wanted to get into leadership within the institution? Is that something that you kind of fell into, or something that you purposefully pursued? Obviously, we have a lot of physician members that do work within systems that some of them may have interest in getting involved in leadership. So any thoughts about your journey, how you got there, and kind of how it started for you?
Yeah, so I had no formal training in the leadership role. You go back again to pre-2010, leadership training for physicians wasn't as popular as it is today, and there certainly weren't as many available resources. But during the course of my employment and working as a gynecologic oncologist, I was pretty vocal with regards to the things that I think needed to be improved with regards to the physician experience and with regards to the employment arm of the facility. And in 2010, when I was offered the opportunity to kind of put my money where my mouth is, come on over here and help us improve things, it was an opportunity that, quite frankly, I really couldn't say no to. I was at the point in my career where my children had all left the house. We were empty nesters, and I thought it would be a good time to really take on a different role and to see how I like it. I was very clear with those that asked me to do that at the time, that if I don't like this, I want to make sure I had a quick out. And obviously I've been doing it now for 11 years, so it tells you that I like it a lot. I've learned a lot. I've been involved with things that most physicians will never get involved with. Every day is different. And I find it, quite frankly, very exciting. The last 16, 17 months during COVID has been some of the most challenging that I've ever faced in my career. And I know that's true for every physician and every clinician that has been at the front lines during this pandemic. It's been really my honor to lead the group through this, to try to provide them with the resources that they need, and to be their voice at the table with regards to exactly what they're going through and their needs on both the acute care side as well as what we call the integrated health service side, or the side outside the hospital.
So, Dr. Finkler, we have a lot of young members and medical student members in our organization. What can you say to them that will help put them in that trajectory toward leadership?
So first and foremost, every physician is a leader. Whether or not you look at yourself as a leader or not you are a leader, the clinical team looks at you as the leader. So that's number one. So as I used to tell my children, people are watching everything you do and behave in an appropriate fashion that you would be proud of and everybody else would be proud of. Number two is if you're interested, number one, raise your hand and make sure your interest is known to those around you. And then take advantage of all the leadership opportunities that are given to you. Leadership usually starts with pretty small roles. And as you demonstrate your capability and your interest, usually what will happen is that there's plenty of opportunities. In a system as big as ours, there's always opportunities. I am always looking for physician leaders. I'm always looking for CMOs. I'm always looking for somebody that's willing to take leadership roles and fill in the blank. And so I would just tell everybody, make sure you speak to the people that can get you those positions and make sure your interest is known. I would tell you that in my era, the formal training probably wasn't as important as it is today. I would think that formal training is a little bit more important today. And whether you want to do and get some more formal training through something like the College of Physician Executives, or whether or not you want to do formal MBA or MHA programs, I think no matter what the course is, you will benefit from those learnings. I've kind of learned the financial end of this literally by being on the job. But that to this day is one of the areas that I wish I had a little bit more experience. The good news is I'm surrounded by financial experts. And so if I have a question as to how things work, I could go 2 doors down from where I'm sitting and speak to my CFO, and he'll be happy to sit there and explain it. But make your interest known, take on leadership roles, get some formal training if available to you. Those are really my 3 big take homes to those that are interested.
Fantastic. So let's talk a little bit about the new position and dive a little deeper as far as your experience over the last number of months dealing with the pandemic. Obviously, you were in leadership before this new position, so you've been intimately involved in how the system has helped our community respond to the pandemic. Are there a couple lessons learned or major keys that you guys have learned throughout this process you want to share with the physicians?
So the answer is yes. And I think one of the blessings that we've had out of this global health crisis is that it has taught us in healthcare in general that we can innovate quickly and we can evolve our processes to meet the changing needs. Historically, healthcare doesn't move very quickly. The reality is, I believe I've seen more change in the last 15 months than I've seen in the last 30 years. And it's been brought to us out of really, quite frankly, necessity. Our clinicians led the way during the pandemic. And quite frankly, they did an incredible job. We learned how to be collaborative. Again, one of the items that we did learn is how to break down those silos between our old North and our old South. We did learn that we are a much better unit if we function as one versus functioning like 20. So how do we communicate? How do we coordinate? What's the best place for a patient to be? And as a result, I would tell you that a large portion of the country began to look at AdventHealth and our clinical care of complex patients and to start asking us how to do fill in the blank. Several best practices that came out of COVID-19 arose out of AdventHealth, and these have been published in things like peer-reviewed journals, including the New England Journal of Medicine Catalyst. Part of our vision was really throughout all of this in AdventHealth is to treat the whole person. And this really requires our providers to meet patients where they are. So rather than be at we typically have had this very rigid concept of care is given in a hospital. And I will tell you that really one of the things that COVID did, it made us think, how do we start to provide care out of the hospital? So we started to do remote patient monitoring, telehealth. I mean, I realized I spent the last 7 years of my life pre-pandemic talking with our providers about how could we do telehealth. The pandemic hits and all of a sudden telehealth is the major way that we're providing care. And the reality is that we're meeting the patients where they want to be met. Patients still prefer to be treated at home if at all possible. We know that telehealth is here to stay. We used a platform called Vivify to do remote patient monitoring, which was highly successful. And we're now expanding that remote patient monitoring to do what we call dispatch health, where we're able to care for patients within their home. We're going to start with relatively, I'll say, easy diagnoses, things like some viral infections, some COPD exacerbations, but we'll eventually learn more and take those learnings and start to apply it to really more of that care at home, or if you'd like to, as people have called it, this hospital at home. I again think as we start to come back to normalcy post-COVID pandemic, I think one of the major roles that I have really is to bring us together as a cohesive division streamline our clinical operations, provide efficiencies, and develop clinical best practices so that we can actually bring the best care to our patients at the best cost as well. So we'll continue to make progress. The COVID-19 has been a very interesting time for all of us. I think it has had an enormous toll on our workforce, and it's not just our physician workforce, but it's our entire clinician workforce. And we are not alone, as you're all aware. It's the workforce around the world that is really, quite frankly, has had difficulties with what we have faced in this pandemic, and it's going to take us a while to get back to something that we're going to call normal. But I don't believe we're ever going to get back to what we had pre-pandemic.
And on that, I may have you comment a little bit, and we were having this conversation earlier about the ongoing impacts of COVID around vaccination. I'd be remiss, the timing of this interview, if we didn't mention something. As of course, we're seeing a resurgence, a little bit of hospitalizations. So do you want to comment at all about the impacts you guys are seeing on the ground with the new variants and ongoing COVID infections?
I'm happy to. So we had a nadir in our inpatient hospitalization from COVID mid to end of June. June 24th was actually our lowest inpatient census date. And since June 24th, today being July 8th, we have seen about a 30% increase in the admissions, both to our ICU as well as to our non-ICUs. Every one of these admissions is in the non-vaccinated patient, and all of our deaths for the last several weeks have actually been in only unvaccinated patients. So I do think it speaks volumes to the fact that vaccines do prevent you from developing severe disease that will get you hospitalized and/or take your life. It may not prevent you from getting the disease, and we know that vaccines are not 100% protective. And even if they're 95% protective, 5% of a very large number is still a large number. So I want to make sure that people don't point to the fact that, well, we still have people that get COVID even after vaccinations. We know the breakthrough rate is not zero. The emergence of the Delta variant and the Delta Plus variant are things that are very concerning. We know that the Delta variant is far more infectious. The Delta Plus variant may even be not just more infectious, but may be more toxic to the lungs based on some preliminary data. And right now, we do believe that the Delta variant will become the dominant variant. We do partake in surveillance studies with the Department of Health in the state of Florida. And last week of our COVID-19s, 26% of our COVID-19s were Delta positive. And I anticipate this week we will see that number even higher. We know across the country it's higher. And if you look at places where the total vaccination rates are below 70%, we know that Delta variant is going to continue to take force. Hospitalizations will go up. And oh, by the way, we're no different. If you look at the US numbers for the last week, US hospitalization rates are up at about 10% as well. So this is all consistent. The best way we get back to normalcy is if we reach herd immunity. And the easiest and quickest way we reach herd immunity is to get vaccinated. The whole issue of whether or not we're going to need boosters remains unclear at this point. We've seen recent data, at least from the J&J vaccine, that said in 8 months, the antibody response and the cellular immune response look very robust. And as of right now, we don't know when and if we're going to need a booster. We do anticipate, however, that we are going to see seasonal variations in this as we go from a pandemic to an endemic state, just like what we see with the flu. I had an interesting conversation just this morning with my epidemiologist, ID doctor, and I was asking him even of what does he think we're going to have to do next year with regards to our flu and our boosters. And the answer is he's not sure yet. Lots to come on this. Again, most important thing is this needs to be based on data, and we will have data before those decisions are made.
Those are some great reasons for people to get vaccinated. I've seen some reluctance in some healthcare workers to get vaccinated. How do we get that message out to those people and ask them to participate also?
It's a really great question. Even within our nursing group, workforce, we do note that the vaccine rates aren't as high as we would like. And I actually think one of the major reasons, particularly in the nursing side of this, is the fact that they are hesitant because of potential impacts on fertility. And what I hear from my nursing cohorts are, I know you reassure me that fertility is not affected, but can you point a study to me? And the answer is, I don't have a randomized controlled trial to point you to this. The best evidence that we have is that fertility rates look no different in the vaccinated versus the unvaccinated. And the live birth rate looks no different in the unvaccinated versus the vaccinated. So I believe our best evidence, and supported by the American College of Obstetricians and Gynecology and the Maternal Fetal Medicine Society and the neonatal societies, all recommend young women get vaccinated. Because the reality is COVID, if you're pregnant, is potentially lethal. And so anything you can do to prevent COVID, if you're in that pregnancy group, a pregnancy desiring group, we think is beneficial. There's a whole nother subset of the population that is just distrustful of the science. And there's lots of reasons why they're distrustful of the science. And a lot of this, I believe, will take one-on-one conversations. The mass vaccination efforts to get to people that are just distrustful is not going to be effective. And I think we've proven that across the country. Our vaccination rates are very low. And then, of course, we have the other population. That's the 12 to 16-year-olds, the 12 to 20-something-year-olds. These are the group that say, I'm young, I'm invincible. Even if I get COVID, it's not going to hurt me. I'm good. And the reality is we have lost young people in our institution who had the exact same attitude. I'm young, I'm healthy, I don't have any comorbid condition. COVID's not going to hurt me. And in fact, it did more than hurt. It actually killed some people. So, again, I think it's about educating. And I think we have to go to those that are hesitant to try to get them to understand. There's obviously going to be a subset of the population that it doesn't matter what we are going to tell them, they're just not going to do it. Those are the ones that we're going to be caring for in the hospitals.
What a great response. And I know we're coming to the close of the interview, but I did want to give you an opportunity to talk about brighter days and the future of the system across the region and kind of your position in the new role and where AdventHealth sees, the next several years for healthcare delivery in the community.
So one of our goals is to be a top national brand. And becoming a top national brand means that you deliver top quality in the clinical products that you deliver. And we are dedicated as a system to increasing our quality through focused leadership and the entire commitment of our clinical teams. We have several parameters that we use to assess clinical excellence. But the three key criteria that our system uses to look at us includes the CMS 5-star rating, the Leapfrog A rating, and then our ranking within a top quartile of national mortality using the Premier Healthcare Database. So I'm really pleased to say that within the CMS 5-star ranking across Central Florida Division, we have achieved 5 stars in AdventHealth Orlando, AdventHealth Daytona Beach, and within the AdventHealth Orlando, that includes all of the hospitals that operate under that license in Orange, Seminole, and Osceola counties. In addition, we've received top awards for achievement, including national rankings for top teaching facility and national rankings for top community facilities, all of which is really phenomenal. Within that 5-star ranking, I think everybody needs to understand, to achieve a 5-star ranking from CMS 5-star is really an incredible achievement. Of the 4,500 hospitals roughly in this country, only 13% achieve that 5-star ranking. And it really takes a collaborative effort of skilled clinicians and a tremendous amount of work to get there. Medicine changes, healthcare is constantly evolving, and our goal is not to sit on our laurels of our 5-star ranking, but as the parameters and the metrics change, our job is to continuously improve and to make sure that we have the best to offer and are providing the best care. Within the Central Florida Division, we have physicians leading in their fields. We've had folks that have published in every major prestigious medical journal. We have leading research studies, and we have people that share their knowledge and their expertise at the national level at conferences, and those that sit at both state and national leadership levels. We very recently have had several of our physicians, in fact 5, that were just voted among the top 2% of global scientists, which is really pretty remarkable. And I think it's just a tribute to the work that we do. Within the leapfrog rating, I'm happy to report that multiple AdventHealth facilities in Seminole, Orange, Osceola, and Volusia and Lake counties all received an A safety grade rating from Leapfrog. And Leapfrog, by the way, is 27 measures of patient safety, which is all based on evidence as well as opportunity for improvement. Newsweek ranked AdventHealth Orlando as number 126 in the nation in best smart hospitals. And I think that just, again, speaks to the fact of the role that AdventHealth is playing at the local and national level. The U.S. News and World Report 2021 list of best hospitals should be announced in late July, and we anticipate being ranked highly again. AdventHealth Orlando, AdventHealth Waterman, and AdventHealth Daytona Beach were all recognized by U.S. News and World Report for best hospitals in 2020. AdventHealth Orlando was ranked number 1 in the Orlando metro area, and number 3 in the state of Florida last year. So again, we are looking forward to that release, which should come shortly. In the interim, the U.S. News and World Report did release their rating of Children's Hospital, and AdventHealth for Children's was selected as the best children's hospital for newborn care in Florida and ranked number 35 in the nation for neonatology. So again, these statistics that I've just shown you and talked to you about, I just think, again, speak to the clinical excellence that we provide and the journey that our clinicians across our entire Central Florida division have been on over the last several years to make sure our communities are provided the best care possible.
Fantastic. Well, we definitely appreciate your time today and for spending a little bit of your busy schedule talking to us about the new position and where AdventHealth is moving in that direction. We certainly wish you all the best. Thanks for being a part of our physician community, of course, and for sharing some of your leadership tips and thoughts around the pandemic as well.
Yes,
Thank you, and thank you for having me.
and Dr. Thank you for your leadership within the AdventHealth system, as well as in our community, and the legacy of teaching that you're leaving behind you. Thank you.
Thank you.
It's like